yourself and your associates that are with you. And then we have the one question of whether you can operate within the mayor's proposed budget, which afterwards you may, if you have any presentation, may do so. If not, we'll open up the floor to council members.
Thank you, Mr. Chairman. I'm Dr. Bill Paul. I'm the director of the Metro Public Health Department, and with me are Mr. Jim Diamond, who's the acting director of the Bureau of Financial Administrative Services, and Diane Harden, who's our finance manager. This is our last budget hearing, if I may. I'll just talk for a couple minutes. Last budget hearing with Mayor Dean and with many of you, and I want to thank you for your support. In public health, success is often about epidemics that don't happen. We have not had a measles outbreak here, but we have to keep pressing to make sure that the children are immunized against measles. We have not had an Ebola case, but we need to be vigilant and thoroughly prepared. For several months now, we've been closely monitoring the health of travelers coming from parts of the world that are affected by Ebola, working with hospitals and others so that we're ready to detect, prevent, and respond. Other things that don't get too much fanfare are improvements in our health as a community. But there has been some progress over the last 8 years, and I believe our work, the work of partners in this community, and your investments have made a difference. And I'm going to just list a few things where our health is getting better. First and foremost, Nashvillians are living longer. One of the key measures of our health, our rate of premature death, has been declining. And in Nashville, it's been declining a little faster than the state of Tennessee as a whole. On the obesity front, the percent of Metro school children who are overweight and obese has leveled off. It's even dropped a little bit, from 39% in 2008 to 35% in 2014. We have a long way to go, but we have started to see progress. The percent of moms who choose to start breastfeeding has increased from 61% to 84% in 3 years. The teen birth rate has declined by 60%. TB cases have declined by a third. HIV cases are down by 24%. HIV deaths have declined 46%. There was a recent publication called County Health Rankings, and Davidson County moved from 13th in the state to 6th in the state, and we are the healthiest metro in the state of Tennessee. That's good news. But Tennessee is the 45th healthiest state in the 23rd healthiest nation. So we can do better. We are making progress, but we know that we have a long way to go. Turning to the budget, out of our overall budget of $42 million, over half, $24 million, is funded by grants and contracts. These include WIC Nutrition Services, Ryan White, HIV, school nurses, communicable diseases, emergency preparedness, and air quality, among other things. Local taxes and user fees invest $18 million in public health. The mayor's proposal includes 3 modest improvements that we had requested: $83,000 for expanded dental services, $137,000 for additional Metro animal care and control staff, and $100,000 for increasing the availability of spay and neuter services. First, on dental. Nashville's dental safety net needs mending. This has been a persistent problem for quite some time. We're very grateful to the mayor, grateful to you as the Metro Council members for putting us into a state-of-the-art building, which has a state-of-the-art dental clinic. Right now, we don't have enough staff to use that dental clinic to its full capacity, and we should. We could serve more children, meet the needs of more adults, especially adults with emergency dental needs. So that request is about $83,000 to make full use of our dental facility, serve approximately 100 more patients a month. This would support a part-time oral surgeon, a part-time hygienist, and a dental assistant. These will enable us to dedicate 1 full day each week to providing additional emergency dental care to adults. Will also help us provide oral surgery for children and serve more children each month. This won't solve the problem, but it's a step. We'll continue to work with others in trying to solve the dental safety net problem. We're also requesting about $137,000 for 2 kennel staff and 1 field officer for Metro Animal Care and Control. The field officer would improve our response times and increase our availability for community outreach. The kennel staff will help us keep the shelter open longer at more convenient hours, increase our capacity and our efficiency, and help us better leverage the available donations. Finally, we're advocating for $100,000, or included in the mayor's budget is $100,000 for a community spay-neuter program. We know that animals just keep coming in, and we are not going to be able to adopt our way out of a pet overpopulation problem. So what we're proposing is to fund really a comprehensive community spay-neuter program, which will support approximately 2,000 spay-neuter surgeries for families that would otherwise not have access to that, in addition to addressing the common barriers of transportation and education. We do put a lot of energy into adopting out animals. We've had great advances in our numbers and in our performance as an agency. We've had phenomenal partnerships with rescues that have helped us in part with this. But again, we can't adopt our way out of a pet overpopulation problem. And so to keep moving in the right direction, we want to increase the percent of animals in the community that are spayed and neutered. And so in conclusion, I forgot to answer your question. Yes, the health department can operate under the budget that's proposed, and I'd be happy to take any questions you might have.
Thank you, Dr. Powell. We'll open up the floor to Council Lady Moore.
Thank you, Chair. It's good to see you, Dr. Paul, even though I see you on a monthly basis, when I can. But thank you for being here, you and your staff. I'm glad to see, I was looking at page H38-2, where one of your goals, as you said, reduce pet overpopulation and reduce the number of dogs and cats that are euthanized. And then you have down at one of your strategic issues, one of the bullet points, the same thing. And I got some calls about cats, what is those, feral cats?
Feral cats.
Yeah. And so, and is that inclusive of that as well to help with that?
So this particular request is not for a specific program on feral cats. There is a community-based organization in town, and we've been working with them, and they are really addressing feral cats kind of on a voluntary basis, with a particular strategy for that.
Okay. What's their name? Do you have a name for?
The name of that organization is Pet Community Center.
Is that one? I saw one in Mount Juliet. Is that one, or is that something different, or is that something?
I'm not familiar with.
Could we get the name of that? Yeah, because that would be helpful in case some constituents call us about, because I've heard that has been a problem. So that would be really helpful.
Yeah, no, I know it's an ongoing problem in some neighborhoods, and the strategies, we're open to strategies that members of the community are interested in pursuing, and so we've had this group that's I think had some success in the first year of operation in Davidson County.
Okay, thank you.
Council Lady Weiner.
Thank you, Chair. I appreciate you calling on me before Councilmember Glover. We're having a contest over who gets to ask the chicken question.
Oh.
So, have the fees generated from chickens covered the expense to manage that new piece?
The actual marginal cost of responding to chicken complaints has been really small, and so it has not required us to budget additional time. So I believe we've been able to cover the request for chicken chicken permits without additional need for budget.
Okay, thank you. Did you have any other questions, Mr. Glover? So I want to move on to something that is near and dear to my heart, and that's audiology and speech pathology. I know you had a part-time audiologist for several years, and she's no longer here. And I noted that there's also no allocation for a speech pathologist. Where are those audiology and speech pathology patients going now that were originally covered, primarily children, who were originally covered by those two practitioners here?
Yes. You're referring to a program called Children's Special Services, which is a grant that we get from the state for specific medical case management services that have no other way of being paid for special need kids. And so as that program has evolved at the state level, they have been focused more on the local health departments providing the case management services and much less on direct services. And so they've contracted with Bill Wilkerson Center at Vanderbilt, and that's who they've designated as the place for our CSS patients to receive their services. And so we had quite a long conversation with them, and based on the design of the program at the state level, we determined that they really wanted us to send those patients there and no longer support the direct services that we were doing.
Okay, so there are no diagnostic services provided by the health department, obviously, because you don't have those two.
We don't have the staff. We do have equipment. We do some hearing testing in relation to our role as the civil service medical examiner. But for children, no, we don't have services of that kind that we're able to offer.
Okay, I'll ask a question later because this had nothing to do with the budget about how you're doing the testing with no audiologists, but that's a different question for a different day. In terms of the budget, so the CSS money from the state is not coming to the health department now, it's going to Bill Will? Or do we have a separate contract and it just flows through to Bill Will from us?
The contract doesn't flow through us. We are really kind of a management and referral, and that's what the state says we had been already funded to do.
Okay, cool. Thank you, I appreciate it.
Council Lady Langster.
Thank you, Mr. Chair. Good afternoon, Dr. Paul, and to your staff. It's good to see you. In the budget, did I miss seeing any money for SIDS, or is it no longer a major problem as it once was in Davidson County?
So I'm glad you brought that up, Councilor Langster. Certainly sleep-related deaths are still an issue that we're paying a lot of attention to. We have a program that's called the Fetal Infant Mortality Review Program, where we're really going in depth on every fetal death and every infant death in Nashville. And we do know that there's still a significant number of sleep-related deaths. Some things that probably years ago might have been categorized as SIDS, we're finding are related to sleep conditions. So we're trying to get the message out every way we can and actually use funds from the FEMA program to reiterate that babies should be sleeping alone on their back and in a crib. It's the ABC. And so we've had that campaign going on for years. We may be starting to see a difference in terms of the number of sleep-related deaths, but that's really where most of our focus is on that particular issue.
So you do have money in the budget, or you rerouted a different way? I didn't get.
There's not a designated grant that's specific to SIDS. Certainly for sleep-related. Prevention of sleep-related deaths, yes, we got a little bit of an increment within the FEMA program.
And I did understand you to say it's still a problem in Davidson County and throughout the counties in Tennessee.
Correct.
Thank you.
Councilman Glover.
Thank you, Mr. Chair. I'd like to go back to the $100,000 on the spay and neuter program. About how many animals are spayed and neutered now? Because I can't pull it out of the budget here.
Most of the spay neuters that we're involved in are for the animals that are flowing through our facility. So on average, we're at about, for many years we were at about 1,000 adoptions a year. We're up to at least 1,500 adoptions per year last year. And all those are spay-neutered, and some of them are spay-neutered by our in-house vet, and some of them we have partnerships with others. We ourselves have not funded community-based, low-cost spay-neuter. And so this would be something new for us, and we would be anticipating funding 2,000 additional spay-neuters, roughly, for families that don't have the means to pay for them.
Okay, well, I guess that sort of answers the next question. On the current ones, are you collecting a fee for when this is done? I guess if someone adopts the pet, is there a fee that's being collected?
Yes, in general, there is an adoption fee and a schedule of fees. There are times when our census in the shelter is so high that we just want to move them out, so we will run specials from time to time. But
Okay.
there is a fee, and the fee is designed to cover the cost of the surgeries and the immunizations and everything that those animals, at least partly recover the cost of making those animals available for adoption.
Okay, and for the $136,900, 3 FTEs there, is that going to be, I think I heard you say to expand hours somewhat for operation, or is that going to be primarily in the field?
One is primarily in the field, and Lauren Bluestone is our new director of the MAC program, and has really carefully looked at staffing, kind of redesigned how we're structuring the staff and the supervision, and we determined that that optimal staffing with a modest increase would be to add 1 field officer and add 2 kennel staff, and so that's what we've asked for. The field officer is really about response time, also about other elements of community responsiveness. The 2 kennel staff really have to do with flowing animals through the operation, making our sales available to the community for adoptions, and taking care of the animals that are in our custody,
Okay,
in our care.
Thank you, Mr. Chair.
Councilman Tiger?
Thank you. Dr. Paul, sometime ask Mr. Diamond about his experience on rollerblades, and you'll get a good
Okay,
story.
I'll do that.
First question, the 13,000 food safety inspections that you all do annually, what's the range or failure rate for those establishments that are below standard?
I don't have that answer for you right now. I can get it for you.
Is it low? I mean, I'm assuming
yeah.
that we have clean and safe restaurants.
Yes, and our staff will not let them operate if they're not safe. So there are situations where we'll let them fix something right on site. The number that we actually have to suspend operation or do something more significant to the business is very rare.
Does the fee charged the establishment for the safety inspection cover the cost of the program?
Yes, it's done through the state health department, but basically the revenues flowing to that program are equivalent to the budget that you appropriate for that.
When was the last time that fee was raised?
Do we?
It's been a while, and at one point, 5-6 years ago, we did sort of a study of a lot of fees across government to make sure that we were maintaining the cost of inflation and salaries and whatnot to limit the impact to taxpayers.
Yes, those fees are actually, I believe, set by the state health department, so they're not in our purview. And
Gotcha. All right. How do you advertise the donations that you all receive for, I mean, there's page after page of weather radios and animal food, and I even see something from some guy named Mike Curl that was donated in here.
how do we advertise?
Yeah, I mean, how do you solicit? Is that something that there's a sign at each health center saying donations accepted? Here's a suggested list of, dog food, baby diapers, play toys, whatever?
I think in general, we don't position ourselves as seeking donations. Oftentimes with animal control, people will offer and will ask. Is that accurate? So we're not advertising or soliciting. Some of the things that are reflected as donations there might be that the state has purchased something and they want to donate it to us as a local entity within their
Well, a little sign out
constraints.
front, our current needs, for cat litter or diapers or whatnot would.
Definitely that does occur. I forgot. We had a significant issue with a dog fighting ring and a number of animals that we were taking care of, and the outpouring of support from the community. Yes, we were able to use social media and other communication networks we have to make specific requests for urgent needs, especially in animal control.
You know as well as I, this is a caring community, and if there are needs, you put the word out, and sometimes you're really amazed by the number of folks that step forward. We also had a push several years ago to make sure all metro buildings had AEDs covered. Have we finalized that program that we don't have to worry about it, that there's enough placed around if someone has a problem in a metro facility that assistance is nearby?
If the health department was leading that for all metro facilities, that's news to me. But certainly within the health department, we've had AEDs, and we were early adopters of that.
I can't remember exactly who led that charge. I know it was a partnership with Vanderbilt, and we were making sure that, you know, every library, school, athletic facility, any place that a catastrophic event could occur. And I'm just curious as if we've met the needs from your perspective.
Certainly, it's a great technology. We had an actual successful save at the health department, so it's certainly something we support, but we have not had a metro-wide role in it.
Sure. Final question. How dependent upon you are for federal grants, and how seasonal or how fluctuating are they that puts pressure on you year to year of grants coming and going away?
Well, the majority of our budget is grants. And so some that are competitive, they come and go, and that does pose some challenges for us. Some even that are not competitive, that come to us from the federal government through the state, typically, you know, if we get a pay increase, our budget from the state doesn't increase, and so that starts to squeeze out positions in grant-funded activities that we have. And so there's generally less flexibility when we're dealing with increasing proportion of our budget on grants.
Are you adequately staffed for your grant writers?
I think right now we're okay. We have a lot of positions that we're trying to fill strategically. I think in the long run, yes, we need to get better and better at writing competitive grants.
It looks like you're like 40 positions unfilled right now.
Yes, we have 509 positions, of which about 53 are vacant today, so about 10%. We've had a significant amount of recent turnover for different reasons.
And what caused that turnover, just generally? Is it salaries? Is it cost of living?
There was a number of retirements. I would say largely retirements. We've had some change, certainly at animal control. A number of staff turned over there as we've kind of instituted new ways of doing things.
None of them caused by having to work with Tom Sharp, I assume.
He's nodding back there.
I understand. Thank you.
Okay. Yeah, I mean, we carry vacancies because there's often a lot of specialized positions in public health, and it's you know, if we're not able to bring them up through the ranks, we have to recruit people who have a fair amount of specialized training and experience, and so that does often take longer for some of the positions.
Thank you, Thank you, Dr. Paul. Seeing no other council members in the queue, this concludes your presentation. Thank you for being here.
Thank you.